And I think it's a great segue as well as we move into the topic of engaging the organization, because it's pretty hard to keep the organization engaged month after month if you don't have a really solid articulated mission statement, as Tommy just went through, and that really clear vision direction. And I think a lot of times what happens with that, and I just really like that point about being ruthless in the pursuit of your vision, and persistent, because I think sometimes it's pretty easy to falter on that. It's also pretty hard to pick that place that we're trying to go sometimes too. So it does take that courage, as Tommy mentioned. So let's talk about engaging the organization month after month. So sometimes the strategic planning process can drag on, and sometimes we move through the planning process fairly quickly, and of course we're into management and execution, and how do we keep people engaged and inspired. So let's look at some tips related to this. And I just thought there were 5 key takeaways in this area as you're driving forward the strategic management process. These are things to keep in mind. A compelling vision. So, Tommy certainly just went through that. The plan and the components of the plan need to be relevant to everyone. We need to hold staff accountable, yes, and able as well. So we'll talk a little bit about that. Measures that matter. And it needs to drive decisions. So I think, kind of keep those checkpoints in your mind. That will help keep people engaged when it feels like the flywheel is not turning, as I like to say. So let's go through these point by point. Having a compelling vision, of course, is sometimes easier said than done. And we're just going to go to the next slide for a quick example on that. This is just an example of the Missouri State Health Department, Health and Social Services, and Elsa and myself had the opportunity to do a presentation out there last week, and wanted to kind of just use their vision statement. I know it's a little hard to see there, but the compelling vision for their organization is Healthy Missourians for Life, and I think that's a really great, compelling vision statement. Certainly. A lot more around that. It's short, it's sweet, and definitely the organization is engaged around making that happen. We kind of talked about the fact that vision can be a hopeful statement, and we can hope that we're going to get there, or we can, as a second choice, ensure that we actually achieve that vision. And a strategic management process is really all about making that vision become a reality and not just having words on a piece of paper. So just an idea of making sure that your vision is compelling and how you communicate that effectively and consistently time after time is a key point to keeping people engaged. Making sure the plan is relevant to everyone. So we accomplish making the plan relevant to everyone by cascading objectives and goals, whatever words you're using. So I think that sometimes the mechanics of planning can overshadow the purpose of why we do different things. So, of course, the MyStrategicPlan system is really built on cascading, and the reason that we built it on cascading is because at the end of the day, we need to see relevance. I, as an individual contributor, need to see relevance of my work to the bigger picture, and I also have to understand and feel capable of accomplishing the goals and objectives that have been assigned to me. So a couple of tips on the sticky note there about keeping it relevant to everyone is it's an action statement so we understand what we're supposed to do. I just really think that's such an important thing. What are we really driving? And we'll talk about that in a minute about measures that matter. That the items that have been assigned to me or that I've signed up for, that I'm the right person to make that happen. And then my other little point there is the right rock size or the right grain size. So I always like to think about the cascading of goals and objectives, and long-term strategic goals are big rocks, if you will, a department objective. So the next level down might be boulders. The division objectives might be stones, and the team member objectives might be pebbles or whatever. And what's important about that is not to mix up the sizes, because when I'm looking at what I am responsible for contributing to, I need to make sure that I actually have the authority to act on the items that I've been assigned or that I've signed up for. So relevance to everyone, that's such an important piece to keeping people engaged. The next item is the whole concept of holding staff accountable, or maybe a little spin on that is holding people able. And that's a little riff from Susan Scott, who is the author of Fierce Conversations. So I give her all the credit for that little twist on accountability. And what I think the powerful point of that is accountability is the carrot and stick, thinking. Holding people able is empowering and communicating confidence in skills and capabilities of our team. And we're well aware of the fact that not everybody has every skill and capability that we need to execute, including ourselves. But the idea of, starting with the best in mind, putting training and coaching and mentoring where it needs to be in order to help people accomplish what they're responsible for is really kind of a twist again on accountability and holding staff able. So just think about that as just a thought on keeping people engaged, because when people feel, and we all know this, when we get demotivated when we feel like it's a whip. We get inspired and energized when we feel like we're empowered to do things and we're excited about them. And that's a very important mental model to keep in mind as strategists and as folks that are responsible for driving execution. So my other little sticky note there as well is just that idea that in order for someone to be held able, they need to be inspired, it needs to be clear and no ambiguity. So just think about those things. The picture that's on the screen is an example of one of our action sheets from My Strategic Plan, and that just gives you a visual representation of what we're holding Tim, our example on here, able to accomplish. So holding staff able. The next item is measures that matter. So there's a lot going on this slide, and I'm not going to go through the whole thing, but I want to touch on a couple key concepts here, and this is just something that we have been coming back to a lot lately in our work, and it's the difference between output measures and outcome measures. So having outcome measures helps people stay engaged because we're driving towards some sort of purpose, if you will, or some sort of greater a greater outcome as opposed to just an output. So here's an example. There's a goal that's on here, and these are medical goals. So for those of us that aren't super versed in that industry, and myself included, I'll try not to screw this up too much. But in the customer area on the left-hand side, you can see that the big goal there is to increase participation in the Stanford chronic disease self-management model. Okay, and we're looking to increase participation from some point right now, which says XX, to 800 by 2013. Okay, well, an example of a measure for making that smart would be the number of participants in the program, because we're trying to increase participation. Okay, fine. Well, as we kind of thought about it a little bit more, actually the outcome that we're seeking is not really just more people in the program. What we're really seeking to accomplish is to drive improvement in self-management of those folks that have chronic disease. So one of the suggestions that was made by the workshop that we were in facilitating this was, and I think I have this right, that we know that an outcome that we're seeking, we know when people who are self-managing chronic disease actually have managed to lower their blood pressure. So it's a bit of a leading indicator to actually improving people's health, and therefore the self-management of the chronic disease is actually improving. So that's more important than just the number of people that are in the program. So that's just kind of a different way to think about outcome measures as opposed to output measures. So let's flow down this strategy map a little bit further. So we know from working with strategy maps that we try to put together cause and effect relationships. So we don't just want to put numbers on a piece of paper just because they're numbers. How are we actually going to make these improvements happen? Well, in the internal area, back on the customer area first, certainly people need to know about the model and learn about how to self-manage their chronic diseases. So the improved communication certainly is a leading indicator to helping these folks understand what's available to them to help manage their chronic disease. We, in the process area, need to put processes in place that help us increase the early detection. So those are evidence-based strategies. Those are internal process improvements that are driven by the people at the Department of Health. And And an example here of an output measure would be the increase in cases where diseases are detected early compared to last year. That's a good example of where we're actually really trying to see change as a result of that improved process. So that process improves, and if we improve that process, and we, as well as if we communicate more effectively to those that have chronic diseases, we will hopefully see the improvement in their self-management of their chronic diseases. So there's a little bit of a cause and effect. Down in the people area, if we're asking people to use evidence-based strategies, they need training on it. So that's where the people piece is related to. An example there, of course, is we're looking for behavior change. So one way, an outcome measure there to manage and look to see whether we're actually seeing action based on the training is how is supervisors documenting improvement in performance evaluations. That's a good example of an outcome measure. What we would normally see there as a measure would be the number of people that attended the training. Again, not a bad measure, but not a very inspiring measure. So again, the switch between measures that matter are outcome-based, not just output-based. And then the last item on here is their financial piece, and that's around financial management. So a couple of things that are going on here and I took a little extra time on this. A couple of things that are going on are, number one, the idea of moving from output measures to outcome measures. And the other idea is helping people see the cause and effect relationships between what it's going to take to drive improvement by linking things together and not just putting a number or a measure out there without the supporting actions, processes, training, funding to make it happen. So measures that matter, really important to keeping people engaged in the process and helping people see the dial move. Measures that change, measures that move, help people feel like we're getting those small wins. Things are moving, things are improving, and that's really important as well. So the next item around keeping people and here are some questions, to move from outcome measures from output measures. So really quickly, what is the result or the outcome of achieving the objective or the goal? Why are we working on this? How will we know when we have accomplished the objective and the goal? And then I like that last one on there is, do our measures tell our story? So those are great questions, and Ryan will be sharing these slides with you. You can use them in your back pocket when you're looking at creating measures that matter. Asking yourself these questions help make sure that we have compelling measures. And then driving decisions. So this is an example of a calendar of strategy meetings and operational meetings. And the point I wanted to illustrate here is, number one, is we keep people engaged by talking about the goals and objectives and progress against our goals and objectives and how we're doing at accomplishing our vision. And that we don't just do it once a year because people are just going to hope it goes away. And most of the time it does. So by setting up a specific calendar where we actually make decisions, a calendar of meetings where we know we're visibly going to talk about our goals and objectives, and it's not going to be a whipping session because we're holding people able, not accountable, that makes people understand that this is not just a passing fad. So what's listed here, and this is just a good example of a matrix that you might put together for your organization, is across the top are the type of meetings, weekly operational meetings, divisional strategy meetings, department strategy meetings, and then all hands meetings. In this model, the toppest level is a department, and then underneath that is a division. So that's how that's kind of structured. So, your org structure is probably a little different. So think about it that way. Down the left-hand side are the different people in the organization, of course, the CEO or the department director, in this case, division manager, team leads, and then individual contributors. And so the point here in this matrix is just to kind of see who needs to attend what meetings, when do they occur, and what do they need to bring to the meeting in order to facilitate a conversation that drives decisions. So really a simple and effective way to link all the meetings together and also provide visibility into the process. So with that, here are your next steps. So how do we do this? A couple of things, thinking about the fact that individual goals and actions are big rocks. They're the big rocks for those individuals. They're not just sequential task lists. So that's a really good way to demotivate people. Making sure that you're actually articulating strategic initiatives, not just business as usual, especially when you get down to the individual goal level. Review those measures and make sure that they're outcome-based, and make sure you've got those strategy sessions set and discuss objectives, not just go around the room and have people rattle off their goals. So those are just some suggestions around how you keep people engaged in some of your next steps.